Measurable residual disease, or MRD, is a very important prognostic marker for progression-free and overall survival. Autologous stem cell transplant for years has been the prime consolidative strategy for patients with myeloma and results in improved depth of response as well as duration of progression-free survival. However, that's not without short and long-term toxicities. So we wanted to use MRD to assess the exact benefit of transplant that it provides patients, and then use that as a benchmark as we are now starting to utilize alternative approaches such as CAR T cells and bispecific antibodies to really define what is the exact benefit that autologous transplant provides by using MRD. So essentially in this study, we looked at patients that were treated at several large academic centers. We pooled results from 2 clinical trials as well as patients who were treated as standard of care at the University of Alabama. Overall, we had about 330 patients, 279 of those treated with quadruplets, 51 with triplets, and we have systematically gone on and obtained MRD responses after induction, and then MRD responses 60 to 80 days following transplant. And we're sort of gathering all of this information to see what is the exact impact of transplant for all these patients. And what we have shown is that the overall MRD negativity rate went from 10 to minus 5 rate of 29% with quadruplets to 59% following autologous transplant, a significant deepening, as much as just under 70% decrease for patients who had MRD greater than 10 to minus 5 pre-transplant, and really resulting in about a 1 log decrease in disease burden. And where this impact is greatest is really in those patients with high-risk multiple myeloma, who really derive a much larger impact with transplant than those who have standard risk disease.